Hi, I'm Rich Bates. I'm a physician at the Women's Health Center here in Alpena. I've been practicing medicine here for approximately 20 years. On my left is Cari Stenz. Cari is a physician assistant at the Long Rapids Family Health Center here in Alpena. She did her undergrad at Central Michigan with an emphasis in exercise science. This is my lovely wife, Cheryl, and Cheryl is a clinical nutritionist, dietitian at Alpena Regional Medical Center and the dialysis unit, as well as an instructor at Alpena Community College. Today, what Tad asked us to talk about a little bit is really the balance that health plays in an overall person's well-being. Certainly you have the spiritual portion and also components of our body and our health. Cari's going to talk a little bit about physical activity and exercise, and Cheryl will talk a little bit about nutrition.
Exercise is a very important part of our overall health for multiple reasons. When you exercise, your body releases endorphins, which are positive hormones that can promote your mood. Even if you're in a horrible mood and you exercise, those endorphins can put you in a good mood and make you feel good about yourself. It's a great way to reduce stress and can prevent conditions like cardiovascular disease, and actually can help prevent having a heart attack. It helps with depression and people are struggling, especially at this time of year. A lot of people struggle with seasonal depression because we don't get the vitamin D levels that we need from the sun. It's a great way to help boost your mood. It also helps prevent comorbid conditions, which are medical conditions that will lead to cardiovascular disease, having a heart attack and stroke. For example, when you exercise, your body more efficiently uses the blood sugar that's circulating throughout your body and can prevent type 2 diabetes and maintain proper blood sugar levels for somebody who has diabetes. So even if you already have a diagnosis such as that, exercise will help your body more efficiently use the blood sugar that you have. It will also help burn calories to prevent further weight gain that will also help you prevent a heart attack or stroke in the future.
I'm going to talk a little bit about the importance of good nutrition in setting your goals for the next decade. The three leading causes of death in this country are heart disease, cancer, and stroke. And each of those chronic conditions has a nutrition component. I guess the first place to start is to talk about how we can use nutrition to prevent these things from ever happening in the first place. There's new research now that shows that if we eat right and we eat the right types of foods, we can actually prevent these things from happening by turning off certain genetic triggers in our body. Our genes sort of determine who we are, but there are triggers that can be turned on and turned off. And by eating a proper diet, you can turn on the triggers that promote good health. When you consider the condition that our country is in now, with 2/3 of our population being either overweight or obese, we need to talk about what good nutrition is. And in considering what you're going to eat for the next 10 years, we need to talk about a few specific things that will help not only to avoid disease, but to keep you healthy from a nutrition standpoint. Good nutrition is important not only to prevent disease, but also if disease already exists. If someone needs to follow a weight management program, if they already have high blood pressure, if they already have heart disease, good nutrition can help to manage and improve those conditions also. When McDonald's opened in 1950, a standard meal was 700 calories. It was a hamburger, small French fries, and a soda. That was 700 calories. Now an average meal at the same restaurant at McDonald's is about 2,000 calories. So when we talk about good nutrition, we're not only talking about choosing the proper foods, choosing the foods that will help your situation, but choosing the proper quantities also.
Well, as you have seen and listened to, Cari and Cheryl talked a little bit about exercise and nutrition. God created us not just as spiritual beings, but He put our souls and our spirits into a physical body. And as Tad has been talking about, or Paul talks about, this is a body, the only body that we'll ever have. And it's incumbent upon us to take care of this body. You know, there's an old quote that I remember, and it goes something like this. And it says, treat your body as if it will be required to live forever. Treat your soul as if it would be required of you today. And that's for me, that's a good saying to remember, how to treat my soul and my physical body. And good luck to you, and I would encourage you, if you have further questions, to talk to a healthcare professional about nutrition and or exercise.